When should biomarker testing be done in lung cancer, non-small cell lung cancer? All of that discussion should happen way before there's ever a tissue sample. The importance of talking and speaking with your doctor and your healthcare providers is critical in this situation. Typically, when you're thinking about what should I be doing with a biomarker, should be at the very first visit when you're anticipating, what is this spot? The first thing sometimes people see is on a chest x-ray. They'll see a spot on their lung and they'll say, well, what is that? And I know that typically what happens is people go into what I call the small brain mode because you're scared. You're like, oh my God, do I have the C word? But you and the people around you have to take a breath and a pause that understands that we are now in an age of precision medicine. And what does that mean? Precision medicine for you all. It means specifically that based on you, we can develop drugs that are highly effective specifically for you and your type of cancer. Well, that actually happens not once they figured out that you have cancer. Those discussions are critical before. The importance of those discussions involve the following. Doctor, if you have to take tissue out, how do you know all the cancer is going to be there? Would I need additional samples in the future? These are all reasonable questions, and as a physician, I have to tell you, they are infrequently asked. I rarely, if ever, get those questions when I'm seeing my patients, and I wish I had more of them. It would force me as a physician to say, you're right. When we're actually taking tissues, if we have a cancer and this winds up being a cancer, then we're going to take areas around it that are free, what we call margin free of cancer, right? Which means we'll have to take a little extra samples. That's why we want to get all the tumors out. If you're getting a bronchoscopy, one might say, well, how would you do that? You're going with this little scope and a camera. How are you going to get enough tissue? The real answer is that unfortunately we can't get the whole tumor out, but we're going to where we think is the best, would give us the best yield. The truth of the matter is, even when we're trying to diagnose lung cancer, sometimes we don't get enough tissue. It's just the truth. Doesn't mean that they were bad doctors, by the way. We can get into some really amazing conversations about how the cell is all heterogeneous, meaning that it's mixed up. And so you may be in the right spot, but unfortunately have a bad yield. Doesn't mean that they're bad, but it does mean that when it comes to cancer and you see these spots, we have to go after them aggressively, and we both have to have courage on the physician side and on the patient sides. Now, what happens if you say, well, doc, you've already sampled this, I've already had my biomarker testing, and all of a sudden, I've gone for a year or 2 years with feeling fine. Why are you going to retest me? Well, when there are new events that actually happen in your chest, we have to know. Interesting enough, with mutations, a crazy part about that is that mutations don't know that they should always stay the same. It is possible that you can have one mutation and then several years later develop another. I wish I could tell you that I could only say that there could only be one mutation at a time. I'd be lying. This is the wonderful partnership of both patients and doctors speaking to one another, not after the fact, but before. And we are really in an amazing age of precision medicine right now, where we're able to finally get rid of just the laws of average and look at you as an individual patient and tailor therapy for you. We're at a wonderful age and wonderful time in history.